The assessment of gambling is an important topic to consider. There's two major areas that you want to assess in terms of gambling behavior itself. First is the diagnostic criteria to assess whether a person meets diagnostic criteria for pathological gambling. These are typically done with some checklists with yes or no items around those specific symptom criteria, such as gambling to escape or financial bailouts or preoccupation with gambling. Another important area to assess is gambling behavior. So how often is a person going? How much money are they spending? Measures of frequency and intensity. The most preferred way and psychometrically supported way is the timeline follow back calendar for retrospective reports. And what this does is it's a calendar method where you actually hand a physical calendar to an individual and you ask them to record their gambling episodes over the past 2 to 3 months. On there they would write what game they're playing, whether it was slots or cards or scratch tickets. They would report how long they gambled for on each episode. Was it 5 minutes? Was it 2 hours? Was it 7 hours? They'd also report their intent before they gambled. So how much money did they plan to take with them to the casino or to the gambling venue to gamble with? Then we next ask them risk. How much money did you actually wager and put on the table or put into the game trying to win? And this does not include money from winnings, but just your own money that you've invested into the game. And then last we ask how much people left with. And that's kind of a way to assess win-loss. We don't ask win-loss directly, we say how much did you leave the casino with. It has less bias in terms of reporting, in terms of some people don't remember the losses as well and they're more likely to remember the big wins. What's nice about the timeline follow-back calendars is you can, from there, you can take this information and you can look for common patterns or behaviors. You can see if their intent is a lot less in terms of what they actually risk. So do they have control? Do they have a plan and are they able to stick with this plan? It's nice for treatment plannings because you can look to see what days are the frequent days that they go. Is it typically Fridays or payday, or is it more times during the week? Is it in the morning or is it in the afternoon? You can get a better sense of their pattern, and this is important for treatment planning and figuring out some of the triggers and what the person's doing.